Mas best friend o kaya minsay pamilya ang turing sa mga aso. Pero para kay Lola Pressy, aso ang naging mitsan ng buhay ng kanyang 12 anyos na apo na si Jojo. Na-impeksyon si Jojo ng sakit na rabies matapos makagat sa tenga.
Pagkasinan, nasawi matapos umanong makagat ng aso.
Bibo at masayahin ang 7 taong gulang na si Joshua Andy Durias at pangarap ang mag-artista. Malaki ang tinamo nitong sugat sa ulo. Nagtatrabaho.
In long time ago, in 2300 BC, rapid dogs kills 20,000 people each year because dogs transmitted rabies to another person. This virus attack central nervous system that causing disease in brain and death. In Philippines, 200 to 300 died every year because of rabies. Rabies occur bite or scratch by infected animal. This is the early sign and symptoms if you have rabies. Pain at the bite site, fever, headache, poor appetite, nausea and vomiting, muscle aches, sore throat, and depression. Sooner or later sign and symptoms, developing fear from water, swelling in brain and spinal cord, excessive secretion of saliva, difficulty of swallowing. Infected animals, changes in bark, changes in attitude, drop jaw, excessive salivation, extreme excitability, fever, uncoordinated, paralysis, pica, seizure, shyness or aggression, unable to swallow. We have different diagnostic procedure, which is the animal testing, or the TFA that looks for the presence of rabies viruses in the brain tissues. Lumbar fracture, this is getting small amount of fluid from the cerebrospinal. Skin biopsies, doctors can use local anesthesia and get small amount of skin sample to check if there is rabies virus protein, and others blood tests and MRI or CT scan. In the Department of Health, there's always a mission and vision. Mission is to declare Philippine rabies free from 2030. Vision is to eliminate human rabies by year 2027. So now, how we can prevent it? And this is the category. Category 1, touching or feeding animals that links on intact skin and no exposure. Washing or exposed skin surface. And in category number 2, nibbling of uncovered skin minus scratches or abrasion without bleeding with exposure. So the prevention is wound washing and immediate vaccination. And category number 3, single or multiple transdermal bites or scratches, contamination of mucous membrane or broken skin with saliva from animal links, exposure due to direct contact, prophylaxis measurement, wound washing, immediate vaccination, and administration of rabies immunoglobulin. The first aid or the immediate action, washing of the wound for minimum 15 minutes with soap and water. Forbidden, iodine, or other substance that remove or kill rabies virus. The Philippines is one of the highest world terms in rabies prevalence. And still, this is the health threat in the Philippines. According to the Department of Health, 200 to 300 Filipino died because of rabies every year. And according to Anti-Rabies Act 9482, the components which is mass vaccination of dog, establish of central database system for registered and vaccinated dogs, impounding field control and disposition of unregistered, stray and unvaccinated dog, information and education campaign on the prevention of control of rabies, provision of pre-exposure treatment to high-risk personnel and post-exposure treatment to animal bite victims, provision of pre-immunization or pre-exposure prophylaxis of school children age of 5 to 14 in areas where high incidence of rabies, encourage a practice of responsible pet owners. If you are a pet owner or a pet lover, be mindful. Having a dog is a huge responsibility, making sure that it's vaccinated against rabies. Don't let your pets in the street to avoid infected to this virus. Learn the body language of the pets. Taking care of your pets. Keep your pets away from stray dogs. If you have severe exposure, immediate wash with soap and water. Stay calm, but be alert. If there excessive bleeding or bleeding, apply bandage to reduce bleeding. And immediate consult to your doctor. And never handle unknown animals. Be one of us because we are one Philippines.